Today, sec. Today I'm going to go through like a MRI report from someone after an accident for the neck. Um, I just want to go through this and to help you understand that what you get on these reports doesn't necessarily mean much when you're trying to figure out like how the patient's feeling and what to do in the future for care, unless there's real significant things going on that are causing the patient real severe symptoms that maybe need addressed medically immediately. There's it's just always kind of fun to look at these and just kind of get people to understand like how the thought process is when I receive something like a cervical MRI after an accident. So this was a patient, older person, 65 years old, 64. And it's going to go through kind of top to bottom, car accident, rear-ended, neck thrown around, patients sore when they come in, okay? For a lot of different reasons in accident cases, a lot of MRIs are ordered. So C2, C3, so top of the spine, that's where the first disc is. There's no evidence of disc herniations, canal stenosis, or neural foraminal stenosis. So spinal canal is fine, and there's nothing creating a problem for the space that the nerves leave from the spine. All right, fair enough. Go down, C3, C4. We got posterior disc herniation, 3 millimeters, A to P. Indents the thecal sac, so it's pushing towards the spinal cord, moderate spinal cord stenosis, 8 millimeter spinal canal, A to P dimension, and we have severe left and moderate right neuroforaminal stenosis, so the nerves, there is some impairment for the space of the nerves there. Small end plate marginal osteophytes, so there's some bony overgrowth, which that means that this disc herniation is probably old because there's some bony overgrowth during the repair processes. Then the disc herniation extends beyond the osteophytes, okay? And there's some arthritis in the joints of the spine. C4, C5, 2 millimeter disc bulge results in the thecal sac, impression on the thecal sac, mild spinal canal stenosis, arthritis on both sides of the joints of the spine again, and some moderate to severe foraminal stenosis on both sides. So the nerves there there's some sort of, there's a possible impairment of the space for the nerves there. C5, C6, posterior disc herniation superimposed on a bulge. Disc herniation is 3.5 millimeters, okay? Some spinal canal stenosis, A to P dimension of the spinal canal, 8 millimeters. Moderate to severe neuroforaminal stenosis again. End plate osteophyte changes, disc herniation beyond the osteophyte. So again, this means that this herniation is probably older. C6, C7, 1 millimeter disc bulge pushing towards the thecal sac, no canal stenosis, no neuroforaminal stenosis there, and some anterior end plate osteophytes, so another place where it's a little older. Hello, everyone. And then C7, T1, no disc herniation, stenosis, or neuroforaminal stenosis. So if you didn't know this patient, you would, and read through this, what are you thinking, right? And what's interesting about a patient like this is most of these injuries, or most of these changes in the spine that we're seeing, because this gentleman is 64 or 65 years old, works in labor, manual labor type jobs, it's a guarantee that everything that we're seeing on this MRI report was likely there before the accident. So you have to then sit back and say to yourself, well, how's the patient feeling? And the patient with a lot of folks are going to say, God, with the MRI results like this person had to have been hurting. Well, turns out this patient reports no neck pain prior to the accident. So they've got all this going on and they don't have neck pain. But then the car accident comes along and now their neck's a little sore. And even he didn't even report that much neck pain, but we're still taking imaging after the accident just to rule out anything that may be a big issue that might need a referral. So we go through this with him, and so now we always have to play it safe and say, hey, there's a lot of things on this MRI report. I know you're sore and painful now, but a lot of these things, given your age, job, history, and how these things are presenting on the report, more than likely these were present. All this stuff was present before the accident, and you were not complaining of pain before the accident, and now we're irritated. So these whatever issues that you was working around in the area of the neck prior to the accident was forcefully pushed through ranges that your body wasn't used to anymore, and now we're having inflammatory response and some pain. But all those things are going to reduce with time, and we're just going to stay conservative and do as little as we need to help you. And lo and behold, 2 weeks go by, and the patient is back to telling me that his pain levels are greatly decreased since the accident, and he's back to normal work, and he doesn't have as much pain on moving the head. And then I see him again today, and he is reporting that he's pretty much pain free now. So, and we didn't even do anything that drastic for the person. So you just have to remember that what you see on these MRI reports likely was present prior to the accident. The patient wasn't having pain before the accident, and these things were there. Something about the accident pushed them past their level of comfort that the brain had around these areas, and it creates this pain response as the body's healing from the the violent collision. But if you weren't having pain before the accident and all these things were present, then then a reasonable way to think about this is you can get back to being pain free after the accident, even with these things present. So you just have to make sure that patients don't get too worked up and worried about an MRI report when they see it, and that you reassure them that we're doing the right things to help, and the body will always lean towards healing. And you just have to make sure that you keep them on that track, and before too long they're going to be feeling better, back to normal, even though we know that these things are present underneath. So hope that helps. You can go to my YouTube, check out tons of different content I have, and see you next time.